normal shape, it's a down photo. Upper slender skin, eyes with small fused skin in the corners, very like with a large tongue and it's a long scenario. We have it large in the long syndrome, so this is the benefit of having the new glasses. And new glasses. So people are asking for the new.
Yes.
Sir,
Yes, no worries. Sorry.
77 is
77. 77A. Because I cannot read these ones.
You plan to use a brief sensitive archway for initial alignment during fixed appliance treatment. What metal is responsible for heat active property of archway? 78B.
Copper.
Copper, yes.
Yes.
78B. 79 is you are going to carry out simple upper and sideways alignment.
Some simple.
Some severe. With sectional fixed appliance in a patient with cerebral palsy, he finds it difficult to keep his head still, and you find it difficult to maintain isolation.
Yes, we discussed SCT and self-edge primer and light cure complete. Yes. You see this 14 years boy on a current facial clinic for review. He has previously 7 superior teeth removed. Yes, it can be cleidocranial. It can be a golden hair syndrome. Gardner syndrome, sorry, Gardner syndrome. Right. So most likely, but if the picture is not given, I will go with the cleidocranial because I told you that they are giving the most likely syndromes here. And if they are osteomas, then you can go for the Gardner syndrome. So it might be D. You fitted upper and lower appliance for 15 years old boy 2 days ago. She in severe condition taking what we have discussed this many times. 7 years present with 3-dimensional enlargement of the right side of the mandible in comparison with the left. 3-dimensional. So it's a hemimandibular hyperplasia. Fifty-nine is B. 9 years attend for 6-month review for anterior caused by thumb sucking. There has been no change in her macular, and she has a 8 mm jet and 5 mm anterior open bite. She is still in the mixed dentition. 9 years, 6-month review of the anterior open bite caused by thumb sucking. She has a 8 mm jet and 5 mm open bite. She is still in the mixed dentition with a proclined maxillary permanent lateral pucker crossbite and mandibular displacement. You previously explained the patient to link between the and a thumb sucking hair. Mother has sticking plus and bitter taste varnishes and these. They have also tried reward chart. Now you have to go for the intervention. Place the quad helix appliance. Yes, it's expansion. So E. Yes, what's the problem with this? Why E, doctor? Because what is on the palatal side, 10 years age, all other teeth are erupting. When they will cause problem of what eruption will go with other options. Right now, no treatment. Yes, the Tulin cusp is a problem when it's in the upper. It's not a problem when it's in the lower, unless it's causing a trauma to the tongue.
If they have mentioned something like occlusal disturbances, things like that.
You are carrying out orthodontic involving fixed appliance 12 years old boy. The treatment involved the extraction of first 4 premolars. You fitted this appliance 6 months ago, and today 1/4 of the extraction space is not closed. 2 days poor, and you have some years of decalcification at the last appointment, which you brought in the notice of his dad. This lesion seems to have worsened since the last visit, together with the warning to the patient, oral hygiene inspection. Record plaque level, refer him to the hygienist for scale and polish. Yeah. You fitted her and lower appliance 15 years, 2 days ago. She contacts you
400 grams.
the same one already repeated. If strain pedals or cyst that arises from, you can read a book of pathology. This is not like what I'm mouth related questions. They don't, it's never came in the exam. Yes, it's not a mouth question. Which of the following is most common developmental cyst? Not a mouth question. Might be like what in ORE, MFTS, they have given it, but not a mouth question. You're planning the course of fixed appliance treatment using bands as attachment of the first molar. You plan to use resin modified glass and adhesive. What is the most important benefit of using compared to the conventional? Command setting, yes. B. Also, they give the options with them. We're planning to study the effects of orthodontic treatment development with joint inclusion 200 school children aged 10 years with follow-up and collected 4-8 cohort. I think we discussed it many times. I don't know why they send it again and again. They said the class will not cause further population on the low incisor as the effect will be on the lower molars, mainly as the extraction of the inferior teeth. So the effects of the class will cause low incisor molar to visualize and cause space lower of the extracted teeth. Yes. It will the molar will visualize. There won't be a lot of effects on the incisor, so the incisor prescription won't matter a lot. But there would be some effects due to friction of the wire that will actually cause some population of the wire. Those effects would be mild, but there would be some effect, very mild. We failed to solve this question as always, right? Because we said that there's a lot of variability. So if someone has a reference, they can give it. They said 8 times. I don't know. There's no, like what I told you, there's so much variability. Might be there's some reference there because OPG has a variation, like what it's a variable dose. Even the standard, like what CBCT for the maxilla has a variable from 35 to 50 microsieverts. So I think they would be more clear for that. You are planning to place a temporary anchorage device between the lower first molar and the front molar, following and 5.1, which is the most equivalent anesthesia for this patient. It's a mitral valve. So without adrenaline, only one option. He's the best. You can give them small amount of other. You're learning attention. So you observe that he has a mild face, a low nasal breath, and a air. I think it's a fetal alcohol syndrome. Alcohol cannabis, I don't know. I think yes. It's alcohol, yes. Might be they're combining both together. Special recipe for the mother. What is the most suitable simple bonding technique to a ceramic surface? What is the most suitable bond technique for ceramic surface? Ash with hearts, no. H with hydrofluoric acid, yes. And use a saline coupling agent. B is good. Yes, B. Okay, hydrochloric. Okay. Hydrofluoric, 9.6% hydrofluoric acid. Sandblasting and etching with no. So it's basically D. Yes, it's B in is if I can see it and tell it. That's picture shows classic picture. What is the images? 8 years old complains of malaligned teeth. She looks very thin and BMI is less than 17.5. Thin, BMI less. So she's anxious. Refer to behavior reinforcement. I think C. Yes, correct options highlighted. Patient present orthodontic with a cheap complaint of pain in his TMJ. Medical history reveals that he has juvenile arthritis. What would be the first line of treatment? NSAIDs, I think, for TMJs. And then corticosteroids for arthritis. What are DMR? DMARDS. DMARDS.
Disease modify anti-rheumatic drug.
What is this?
Anti-rheumatic drugs. Disease modifying.
So, assuming that the optimum force level are being used, in which of the following option is encouraged loss most likely to occur? Tipping, we discussed for 1925 because highly should be in leveling alignment, but it's a complete phase versus smaller phases. B. I think we are on the growth chart now. According to the study chart, it's a profit question 3%, 97%. A. The mentioning profit. Sarah, like what I think there is a missing information generally interesting, I think, about the effect of. There's nothing now. Just see some. What about taking a photograph, sir? Nothing. No photographs, no. Like what you have to do, the like what because they are deconstruction and you have to do like what go for the oral hygiene reinforcement, scale and polish. In this question like this, Dr. Had, what should be more important? As Ramesh mentioned, force for maxillary restrain as 500 gram. Which question is it? What is the question? They said cervical pull head gear used to restrain maxillary bone, asking for the angle. Okay. For angle force duration. Like a 30, 400 gram, 14 hours. So, like at least at the 30 is good, 400 gram is good, 14 hours is good. So the angle is like what he asked me, cervical pull head gear to restrain maxillary growth, asking for angle force duration. There's no angle in cervical pull head gear. Is there angle? Yes. Just depend upon it's going to the center. Yes. There's no angle in cervical pull head gear. And it's a force level. And the force level depend upon restrain of the maxillary growth. It should be 400 to 4. Yes, 400, 500. And then it's for 12 hours or 14 hours. 14 hours. So for 12 hours is good. The anchoring and 14 hours for the 14 for it's for restraint. So it's a option is correct. 30 is not important. Right. Like what this reversible head gear is important. In cervical, it's not important. In cervical, you have to decide the line of action of force with the center of resistance of the two. Yeah, I think they are asking about the angle of the outer loop. I told you it depends upon the line of action. The angle is also related with the length of the outer loop. Yes. It depends on the length, right? So it's not one factor. Yes. Because if it's like what increased length and you are giving it like what 40 or 35 degrees, so it's depend on the length too. I think we end here. Also clear times. Okay, everyone. See you. I will end here.